All right. We'll wait here for people. Hi, everyone. Welcome. We're just going to wait a few minutes and let everyone get in, get settled, get a drink in hand if you want it, have some popcorn, whatever you want, and then we'll get started. It's definitely getting more cold outside.
Oh, yeah, really so much colder. I think it's going to be a high of 7 tomorrow.
Oh, really? Oh, my gosh.
Yeah. Get out those winter coats.
Yeah, right? We'll take maybe one more minute and then we'll get started. Actually, while we're waiting, I'm just going to remind everyone that if you're going to type, when you type in the chat, if you want to set that little ... button to all attendees and panelists, that way everyone can see what you're saying is fine. It's good. We prefer that versus just to the panelists. Makes it more fun. Perfect. Okay, well, I'll go ahead and get started just so we stay on time and on track. We have a lot today to learn, so we'll get started. So welcome to this vestibular webinar on conquering your dizziness, balance, and vertigo. My name is Jennifer McConvey. I am a vestibular physiotherapist here at PhysioPlus Health Group. I am also joined by a special guest today, Rani Glick from Rani Glick Wellness. I'll let her tell you more about herself shortly. All right, so we have rules already for today. Rules for today. First and foremost, just have fun. We want you to be interactive. I'll ask a few questions, and if you feel comfortable and if you like, you can put it out in the chat for everybody to see. Probably if you're thinking it or you're feeling it, someone else is. So it's great to kind of be in this together. With all this that we're going to learn today, hopefully you're going to feel more confident about taking next steps into conquering your dizziness, and even taking action, whether that be downloading our e-booklet that you'll get at the end of the webinar and looking through it, or discussing your symptoms with your GP, or even booking an assessment or a phone call with us. All right. At PhysioPlus, we like to play games all the time. This game is called Spin the Wheel, but it's really Spin the Name. And this is just a fun thing that we like to do. So all the attendees that are here at the end of the webinar, we're going to put everyone's name in a spin the wheel. And Jess from our front admin team will spin the wheel, and then they'll pick a lucky winner. That winner will win a free foam roller and therapy balls and a 20-minute session with a therapist on how to use them. All right, so who am I? My name is Jennifer McConvey. I am a vestibular physiotherapist. I have about 12 years of clinical experience treating vestibular disorders. I became super interested in vestibular while I was at Northwestern University in Chicago. Right after Northwestern, I began taking postgraduate work and training, which led to just specialty training in vestibular post-concussion and orthopedics. I am a vestibular health care provider for VEDA. VEDA is Vestibular Disorders Association, which is worldwide, which is really cool. And then I also sit on a few advisory boards and research projects here in Toronto. And then our special guest, Rani Glick, I'll let you tell everyone more about yourself and some of the great services that you provide.
Thanks so much. Thank you, Jennifer. Hello, everyone. I'm Rani Glick. I'm a certified holistic nutritionist, and I'm a trainer of the mindfulness-based stress reduction program, and I also do mindful eating. And my main focus is brain health and working with people over 60 and also other ages as well. And I really focus on mindfulness, and this is part of a discussion that's beneficial for what we're discussing here today. And we'll go into more detail when Jennifer talks about that area later on in the presentation. So meditation can reduce symptoms of pain, stress, and chronic illness. It has incredible opportunities to really connect with your body and really have an understanding of how the brain and the body work together. And how the mind is a function of the body. And so as you become more connected with your body sensations and emotions and thoughts through mindfulness, you're able to really have more of a connection with your pain and managing your stress and chronic illness. As I said, you're using your breath that signals the brain to regulate the autonomic nervous system out of a stress state into a more rest and digest and calming state through the sympathetic, parasympathetic, and sympathetic states. So I'm offering a program, a mindfulness-based stress reduction program called Heal to Health, a mindfulness practice for coping with stress that begins Thursday, November 3rd to December 22nd. It's an 8-week program. And if you're interested, you can contact me at my website or through my website or my email. And Jennifer's put that information in the chat. And I'm happy to talk to you more about it and how this could help you with coping with pain, stress, and chronic illness. Thank you, Jennifer.
Perfect. Thank you so much. That was wonderful. So good. All right. So I wanted to start off the chat or the whole webinar today, kind of thinking about what's the goal of our webinar, right? Why are we here? So if you had no dizziness, vertigo, or imbalance today, what would you be doing? Would you be playing with your grandkids? Would you be running? Would you be working out more, being more social, active, all these things? So if you don't mind, if you want to, you can put in the chat anything that you would like. Why are you here today? What is your vertigo, imbalance, or dizziness hindering you from doing? All right, so I'll let you guys kind of think about that. And if, like I said, if you feel free, if you want to, you can put it in the chat and I'll keep moving on. Okay, so dizziness is an umbrella term and it can mean different things to many different people, right? So dizziness could mean that you're feeling like lightheaded, like you're about to pass out, syncope. It could also mean that you're woozy or disconnected, disoriented from your environment. Dizziness to some people means you're off balance or unsteady. Or it can mean vertigo, where the room or you have the sensation that one of you is moving. So I have people come to me all the time and say, I'm dizzy. But that doesn't mean so much to me. So this is why I have all of my patients, when they come in, I say, I want you to tell me how you're feeling without using the word dizzy. Because actually your descriptors of your dizziness can tell us a lot about what's going on. So for instance, if someone comes in saying I'm dizzy versus someone that comes in and says, I feel the room spin when I roll over in bed for under 60 seconds. Well, that tells me a little bit more. That tells me that you might have something called BPPV versus just I'm dizzy. So this is super, super important. We can even go a little bit farther here. And so I want everybody, if you have a pencil, a pen, or you can just think about this in your mind, is I want you to describe your dizziness, your symptoms, without using the word dizzy. So that could be room spinning, vertigo, which is vertigo. It could be rocking or swaying. It could be blurred vision, disorientation. I feel lightheaded. I feel faint, nausea, vomiting, floating. It feels like I'm floating. I feel like my head is disconnected to my body. Any of these things, but I want you to take the time to really think about not using the word dizzy, but just using an actual descriptor of what it feels like. And then we're going to take it a little step further. And I want you to tell me what actions make yourself, make you have your symptoms. So whatever those symptoms are, what is it that makes you have those symptoms? So it could be I roll over in bed, I look up, I look down, I move my head, Busy environments, going to the grocery store makes me feel awful for the rest of the day. Looking at my computer, I'm fine when I wake up, but after 20 minutes on the computer, I feel not well. And then I want you to also list the duration of your symptoms. Is it under a minute? Is it 30 minutes? Anything like that, that we can kind of get narrowed down where your dizziness is and where it's coming from. All right, good. And so why is this important? Because it helps us, if we can get to the nitty gritty of your dizziness and the descriptors, it helps us perform the right tests, refer you to the right people, and ultimately diagnose your problem more quickly and accurately. Over here on the right is a know your dizziness checklist. I give this to all of my patients when they come in, which has all the descriptors, all the duration, everything. So I know more about your dizziness and can kind of direct you in the right next steps. Good. So as you probably already know, there's a lot of reasons for dizziness. So a number of reasons, cardiovascular being one of them. You can get orthostatic hypotension. That's where blood has trouble regulating to changes in positions. These people, when they stand up, get lightheaded for a few seconds, especially if they're changing their position quickly. A stroke is also another, it's actually a pretty rare cause of dizziness. Less than 2 to 3% of individuals experiencing dizziness is actually from a stroke. These individuals also present with more sinister kind of presentations like facial numbness, weakness, slurred speech, confusion, stuff like that. Migraine is another reason that people have dizziness. We'll talk actually about vestibular migraine, a form of migraines, a little bit later in the webinar. Medications are another. I mean, if anybody reads the side of their side effects for medication, lists 5,000 side effects, and dizziness can definitely be one of them. But if you find a coinciding medication, start of a medication and onset of dizziness, then you should contact your doctor and really talk to them about, could, the medication be the cause. And then over here on the right is 3 sensory systems that we use for balance. And so we're going to talk a little bit more about them in the next few slides. But we're constantly using these in vestibular rehab, all 3 of these to help with our balance and improving our balance. So 3 balance systems, 3 systems that we use for balance and orientation. Our vision, obviously, our proprioception. This is just a fancy term for the muscles in your neck and feet have receptors in them and kind of send messages to your brain of where you are in space. And then our vestibular system. So our vestibular system is in charge of keeping our head stable while we are moving and our vision stable while we're moving. So we get a lot of sense of balance from our vestibular system. All right. So let's talk first about the vision as the vision and balance. So you can go to the optometrist and they can look at your acuity. And so anything that kind of degrades your acuity, I mean, like, macular degeneration or cataracts or anything like that, can obviously make us a little off and have blurred vision and dizzy. It also can be how well your eyes move together. So if they can kind of focus and work together for making something, you look at something close and then look at something far. A lot of people actually have a lot of issues that they're not aware of, where their eyes are not working well together. And this can make you have this low-lying sense of imbalance. It can make you have headaches, eye strain, neck strain, because you're really trying to focus your eyes a lot there. So that's also another reason. So in vestibular rehab, We actually screen this by doing a multiple tests. One is just a regular kind of smooth pursuits and looking at how well you can coordinate that. And then we look at your ocular alignment and then have you go from near to far to see how well your eyes are moving together as one. All right, and then we have the proprioceptive system. So again, this is that fancy term we were talking about where it's just the receptors in your muscles, and especially in your neck and your feet, telling you where you are in space. These are really dominant on firm ground. We use this system a bit more, and we use it less probably on kind of dark and not such slippery surfaces. Here, I'm even testing this girl's balance where I have her on a foamy surface, which is altering her sensation from her feet. So it's throwing it off a bit. So then she has to use her other two systems a bit more. And then I could take her vision away and have her solely start using her vestibular system. So that's for the feet. There's another type of dizziness that can arise from the proprioceptive system, and that's called cervicogenic dizziness. So this could be after whiplash, concussions, someone with a lot of neck arthritis, and now they have a little bit of altered inputs into the brain of where they are in space. You could even be tight on one side and loose on the other, and your brain's kind of perceiving a mixed signal on where is center and what center. So I give people kind of the analogy too of if your neck is telling your brain that this is center, but then your vestibular system and your vision are telling your brain this is center, your brain's like, whoa, who do I believe here? Because the vestibular system and the vision's telling me this, but the proprioceptive system's telling me this, and that creates dizziness for people. And it's very low-lying dizziness, but it's still that sensation of being kind of imbalanced and off. I'm just showing you here. This is a video of myself showing, testing someone's proprioception in their neck. So I'm having her with a laser on her head, and then she's having to close her eyes and then try to relocate it back to center. Good, so I'm having her do it one to one side and one to the other. You can even see here that she's a bit off on what is center after coming back from that left side. Good. Okay, so now we're on to the vestibular system. So the vestibular system is housed in the inner ear. It's tiny. It's probably the size of a quarter. It has 5 areas that are constantly collecting information about rotation, tilt, acceleration. So it's very active while we're in movement. It sends all of this information to the brain to help us coordinate gaze stability. So just keeping our gaze stable, especially when we're turning our head. I like to use the analogy of if you've ever seen like the Blair Witch Project or seen an episode where someone with a camera is running and the camera is going up and down like this, almost to make you sick. If we did not have our vestibular system, or if our vestibular system wasn't working correctly, that's what we would feel like when we were walking, because our eyes would go with our head. But our vestibular system actually helps coordinate where our eyes are able to keep everything still and steady. And it also helps with postural stability and then also orientation, especially to gravity. So we'll go to the next thing. So we're just talking about gaze stability, and you can even try to test this out right now simply by putting your thumb out in front of you and focusing right on your thumbnail. And then you're just going to turn your head slightly side to side, just like this, and see if you can keep your thumb completely still. It doesn't shift at all or anything like that. It stays completely still. You have to go pretty fast because the VOR is in charge of head motion when you're going pretty fast there. But that's your VOR in work. You can go up and down, side to side. It's also, you can go highly complex. So I always tell my sports guys, like, this is like you running, skating down an ice rink and then looking for the puck, but also tracking people coming by you and all that stuff. So you can do all those things because of your vestibular system. All right, and now, what are common vestibular symptoms? So of course, if it's in charge of your vision while you're in motion, then you can have blurred or bouncy vision. You can have a vertigo, that's that room spinning, dizziness. You can have falls, imbalance, hearing changes. Your vestibular system and your cochlea, which is your hearing organ, are sitting right next to each other in your inner ear. So inflammation or anything on one of them can cause inflammation and trouble on the other one as well. You can get headaches and motion sensitivity, light and noise sensitivity too. The vestibular system has a little bit of pathways into processing information and stuff like that. So that's where the light and noise sensitivity comes from. All right, let's talk about the #1 cause of vertigo. I'm sure everybody maybe here knows what it is. It is called benign proximal positional vertigo, BPPV for short. So BPV, I actually show you on my little model here. So this is what the inner ear kind of looks like here. Inside this little structure here sits a lot of these little carbonate crystals, and they just sit on the layer in here and just sit above it. They sense when you're rocking back and forth, up and down, they kind of sway back and forth. In BPPV, they can actually get dislodged. So these are just little carbonate calcium crystals, and actually float back into one of these 3 semicircular canals. So you have 3 on this side and 3 on this side here. So they're sitting in here, but then when you go to change a head position, especially against gravity, so say you look up, you look down, you roll over in bed, anything like that, these crystals that are loose, that have gotten dislodged, can actually start floating back into your canal. And you can't really see it here, but these are what we're talking about here. They float through here. Now, these are not supposed to be in here usually. Usually you just have some fluid in here. But when these go through here, you actually tells your brain that you're moving. So then since your vestibular system is highly coordinated into your eyes, you get what they call room spinning vertigo, because it's trying to keep your eyes stable, because it got the information here that your head was moving when really it's not. You just rolled over in bed. So again, these symptoms are spinning sensation. So it's vertigo. Is when people are doing gravity dependent changes in their head. And then usually the vertigo is lasting for under 60 seconds. It can leave you dizzy kind of for the rest of the day, or feeling nauseous, but it's the actual room spinning vertigo lasts for under 60 seconds. And it's every time you're going to move your head in that kind of direction where these crystals are going to kind of fall through the fluid here. So causes of BPPV, most of them are unknown, but there are some risk factors that we know. For instance, about 2 to 3% of the population gets BPPV, but in 50% of the population between 50s to 70s gets BPPV. So we know it's very, very popular. As you get older, it is almost rises exponentially. And we think this is because of 2 different reasons. A vitamin D deficiency, we find that a lot of people that have vitamin D deficiency are more likely to get BPPV. Also changes in blood pressure and changes in kind of arteries and stuff like that can also cause a bit of BPPV. We also know that people that had a recent brain injury or got a knock to the head, you're kind of sloughing off some of these crystals, knocking them loose, and then they're more apt to be going back and causing vertigo. And then there's a pretty good family history. If you have like a dad or a sister or brother, you're more likely to get BPPV than the next person. Reoccurrence of BPPV. So once you get BPPV and it's kind of resolved and treated, you have about 30% chance of getting BPPV again within that year, and you have about a 50% chance of getting it within 5 years. Good. So how do we assess BPPV? So we do maneuvers based off, so like I was telling you earlier, you have 6 canals on each side. So we need to test those 6 canals to see where the BPPV is. If someone is complaining of room spinning vertigo that lasts under 60 seconds and is when they turn their head. So you have to figure out which canal it's in. So you do multiple positions so you can get the head into those positions. And then the practitioner or the person is looking for what we call nystagmus. This is involuntary eye movements that would happen while you're there. So if I was looking in someone's eyes, I expect them to kind of turn like this in their head. So that's what we're looking for, and that's a positive test. And when we know that, like, so for instance, in this picture here, this practitioner is turning this person to her right and then putting her down, that stimulates your posterior canal, which is one of your semicircular canals. And so if she has that eye spinning, that nystagmus while it's there, she's in that position, then we know that it's in her right posterior canal. And then we know which treatment that we can do for this person. But we test all the canals to make sure we know, because you can have it in multiple canals too. Especially that's very popular after a traumatic brain injury or a concussion, that it can be in multiple canals. So here I like this diagram, like when the head moves, the crystals shift back, it gives a false sense to the brain that you're moving, and then you have the spinning sensation, and it's because your eyes are moving in that way. Okay, so how do we treat BPPV? So once we have found the actual canal, then we can select the right maneuvers to help get these little tiny crystals back in to here where they belong. We actually don't know what happens once we get them back in. They either settle down and reattach back onto the surface, or they have a theory that these kind of like dark cells come and kind of digest the crystals. We don't really know, but those are the 2 theories that we have. But we always know that we can, if we can get them back in there, you're gonna resolve your BPPV. I always get this question, so I just added it to the slide. Like people come in and say, I've been doing this maneuver at, my doctor told me to do this maneuver. I went home, I've done it over and over again, and I still have BPPV. Why? Usually it's for these reasons, that people are treating the wrong canal. Maybe they just got a sheet and it just had, for the right side. Posterior canal, and so they just kept doing that canal and doing the maneuvers like this down below, but it wasn't even that canal, so you're treating the wrong canal. The debris could be in multiple canals, so you could have treated the one canal very well, but there's still some left in another canal. And then not maintaining the proper positioning. So sometimes in some of these positions you have to get the head just right. And so sometimes people just don't get that head kind of right into the right positions. People can also have a little bit variation of the plane that their vestibular canals are in, and that can cause not a successful treatment. Or it could just not be BPPV. We see this often too. Someone comes in and says, I've been told I have BPPV. And then I say, oh, do you have room spinning vertigo? And when you move your head, oh no, feel like I'm rocking and swaying all day, or, I don't have that. And so it could just not be BPPV. So that's why it's important to have a really good assessment to just confirm what it is. Other common vestibular disorders. So I just want to take a minute to talk about them just in case someone's here that has one of the others and wanted to kind of touch base on these. I have we'll have a Q&A at the end too, and feel free to ask any questions then. But these talk to vestibular neuritis and labyrinthitis. This is where there's inflammation gets onto the vestibular nerve, and it can this can be from a virus, bacteria, or stress. Actually, stress can cause this. These people get a sudden attack of vertigo and balance lasting for hours to days. This usually affects your ocular reflex, so that turning your head. So these individuals have a hard time moving. They have a lot of imbalance, and it can be unilateral, so only on one side. So when they're turning their head to that right side, they almost feel like they're going to fall over because they have no sense of awareness or balance. So these individuals actually do very, very well in vestibular rehab. We retrain their visual ocular motor reflex in their brain to actually recognize that there's an error there and help improve it. But these are like kind of slow, short, brief exposures that we give them. So then, because it can make you really dizzy, but we try to dampen it down and then have someone progress from there. Vestibular migraine is becoming more popular as we know more about it. This is inflammation on portions of the vestibular nerve as a result of a migraine. These individuals have a past medical history of having a migraine, and then as their migraines are kind of settling down, especially for women when they get into that kind of perimenopausal stage, their migraines start settling down, but then they start getting an onset of attacks of vertigo, imbalance, motion sensitivity, stuff like that. And so these individuals have to be medically managed, but I see them in vestibular rehab in between attacks, just to test their vestibular system and how well they're using the vestibular system and keeping kind of the vestibular system up to par. And then we have Meniere's disease. Meniere's disease is a chronic issue. These individuals have an onset of vertigo, nausea, but it's almost always preceded by a fullness in the ear. It's usually on one side, and it lasts for a few hours, usually. And sometimes it's really debilitating. It can put you down for a few days. But then in between attacks, they do pretty well. They're okay. But when they have those attacks, and some of the attacks, there's no rhyme or reason to them. They can be within weeks apart, within days apart, and then you don't see them for another few years. And that has to do with the abnormalities in the fluid fluctuation or the composition of the fluid in the inner ear. All right, and then we have something called mal-debarment syndrome. This is someone that's been on a plane or a boat, and then they get off of the boat or the plane and they still have the sensation that they're moving when they're not. So they have rocking and swaying constantly. They actually feel worse when they're sitting and feel better moving. These people also do well with vestibular rehab. It's all about reweighting those sensory systems. So we're talking about the vision, the proprioceptive system, and the vestibular system. We start putting them in scenarios where they start being able to switch over quickly between those three systems and start sensory reweighting. Another thing that we deal with a lot is persistent postural perceptual dizziness. This is called 3PD for short, because it's a mouthful. But these individuals actually had a vestibular event, but then weren't able to kind of get over the vestibular event and get back to normal. And that's usually because they had high anxiety, or they had, a lot of worry over the event and couldn't actually settle down their sympathetic nervous system enough to heal. So Rani, this is where I feel like you and your expertise this is beautiful for you.
Yeah, so definitely when you're really in a high stress or experiencing high anxiety, you can really aggravate so many symptoms in your body. You might have a sensitivity already in a particular area, as in this vestibular disorders, or it could manifest in a variety of different ways. But usually a high stress situation would really aggravate, and you go into sympathetic mode. And there's a whole theory of polyvagal theory where the vagus nerve, which is the longest running nerve in the body, and you go into in the sympathetic state, you go into fight or flight, but then you can go into another state, which is the dorsal, where you can go into the freeze state where you can't really get out, and you start to really shut down or go more into a more traumatic kind of posture or sense of crisis. And then you can, and in the theory of polyvagal theory is that once you start to really use the application of meditation and mindfulness, of being able to bring in the values of mindfulness, which are non-judgment, paying attention, being present, and experiencing and focusing on curiosity, you start to really reduce those symptoms of stress and anxiety, very much so by also connecting with people. Being in a social environment also really helps. That's the ventral system. And so this theory really helps as mindfulness can really help to really calm and bring ease and really change the mindset of feeling anxious and stressed.
That's awesome. Yeah, I feel like these individuals, they do well with vestibular rehab only if they're also doing something like this on the side, because they have to calm down this, or they're not going to be able to kind of work through picking which sensory systems they should use properly, because they're just in overload. So
many times that happens because people are, well, in my experience, people get so anxious that it just aggravates the symptoms even more. So mindfulness is a great way to really try to connect with the body and calm yourself down. So
I always tell
you.
people, like, give them the scenario of, like, say you're sitting in class and just a professor constantly starts calling you out to answer stuff, and it really makes you nervous, and then you can't start thinking, and even though you know the answer, you can't start, you can't think because you feel nervous, and your body just kind of freezes and shuts down. And I give them that kind of scenario of, this is what's happening to your body right now, and we need to calm you down so you can have this open, clear mind and heal.
And the way that you would do that is really to start breathing, to really connect with your breath so you can calm your body down. And a lot of people are very shallow breathers, but when you start to really become aware of just breathing a little deeper, it really calms you down. And do like 5 to 10 breaths. And, breathe. You can do the box breathing where you breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and then hold for 4 seconds, and do that 5 to 6 times, and that will really calm you down.
That's awesome. I love it. I even have success with people kind of being like, what's wrong with me? And I don't know what is happening. And even saying like, oh, you have this. We know what this is. This is like something that we deal with. Even just having that calming sensation of, oh, someone knows what I'm going through or what I'm talking about, and just that confidence of, oh, I can like now start the process and trusting it, and it promotes healing, and it's great.
And it's true, like, so many people don't really trust their bodies, like they don't trust what their body is doing, which is the hardest thing to really feel. But as you get more in touch with your body sensations and the way that you are feeling, and with your using your breath, you really feel more sense of control and trust with your body.
That's awesome.
Which is really important.
And then last but not least, we were just talking about this earlier, cervicogenic dizziness. And this is just that sensation that we were talking about, where your neck is telling your brain a little bit of something different than your vision or your vestibular system. So these are common ones. There's a lot other vestibular ones, but these are the ones probably I see most in outpatient rehab. All right, so like I was saying earlier, a comprehensive exam is really important. We're using goggles with people so we can kind of block out some of the light and really see their eye movements and stuff like that. So this was what this guy has, these funny looking goggles on here. We're testing you in multiple different scenarios and trying to wean out where the dizziness lies. So how do we treat in vestibular rehab? Again, we're identifying if you have BPPV, we're identifying where the canal, these little carbonate little crystals are. And then once we know that, we're choosing the positioning maneuvers that we're going to do to get them back in. This little utricle area, and this usually takes between it could be the first visit and you're golden, you're done, between 1 and 5. Sometimes you have multiple canals and stuff like that, but I usually have a 1, 2, 3 strike you're out kind of rule, and strike you're out meaning me, because usually you can treat it within 3 visits, if less. Now, we also in vestibular rehab, we want to enhance your gaze stability with the OR training. So individuals that they're turning their head quickly and have that sensation that their eyes have to catch up to their head, or something's not staying still, they're feeling a little blurry. We can improve that, like I was just saying earlier, with a lot of training. We have a lot of training in this, and a lot of exercises that we do here. We do these though in slow controlled exposures. That way we're not making you too dizzy. And then over time, you're progressing because your body's getting used to it and recognizing there's an error there and making new connections, that neuroplasticity concept, and getting better and better. We also wanted to enhance balance and sensory integration. So for balance, we're changing surfaces and visual and having you turn your head on foam and dual tasking, catching a ball, stuff like that. And then sensory integration, I just have a little note here on the side, is your body's ability to utilize information coming from those 3 systems. You can actually have where you just have a sensory integration dysfunction where your brain is just not processing it well as it's coming in. Over time, you've learned how to use your vision more than your vestibular system or one of the other kind of scenarios. And we're just trying to sensory re-weight those systems to get you back to being able to run on all cylinders instead of 1 or 2. Yeah. And then again, neck proprioception, we're retraining your brain to trust those neck receptors once you've actually done a little bit of rehab on your neck and you're aligned properly, you're strengthened and all that stuff. We're coming back to this and making sure that now you're aligned, but you're also, your neck is sending proper information to your brain. Definitely education equals improved outcomes. The more I can educate someone, the more they feel more comfortable, like Rani and I were just talking about. And so during the assessment, we're discussing the assessment findings, the treatment plan, referrals if needed. If we think that it's more visual, we're sending you out to optometry or neurooptometry, ENT, otolaryngology, a nutritionist, like we were just talking about now, like mindfulness. There's a lot of things that are out of our expertise. I don't think it's, one person can do it all when it comes to this. So we're helping kind of guide people. If it's something that's not in our realm, we say, okay, this is not, you're not, kind of a candidate for vestibular rehab, maybe not just yet. You need to have A, B, and C done first, because I think it'll be more beneficial for you. And then resources as well. So let's talk about everything.
Jennifer, there's a question from Maureen Loweth. It's, what are differences between canalith exercises and epile exercises used for BPPV?
Good question. Okay, so canalith exercises, I'm not sure what that would be, but the epile maneuver, which is I think what she's talking about, epile exercises, the epile maneuver is a series of head positions that you're putting someone in to get those little crystals back into here. So for instance, here, if we look here, this is your posterior canal. Most people get BPPV in their posterior canal. About 85% of people do. And so when we put you back into like that first head position, and these crystals are falling down, it's going to give you the sensation you're spinning, and you're going to get that eye motion and movement. So we know, oh, she has it in her posterior canal. We're going to do a series of head positions to get this back into this little area, the utricle. So we're kind of start here, and you can see even here as I do this, we're kind of moving you around to get them back into here. So you do these series of head positions, and the Epley maneuver is the maneuver that you would do for the posterior canal. So you have to know it's in your posterior canal, and which posterior canal it's in, is it in the right or the left? But then based off of that, you can do an Epley maneuver for the right side or Epley maneuver for the left side. And I don't know what canal lift exercises are, but you just choose maneuvers that are based off of what canal it's in. I hope that answers your question. If it doesn't, let me know and we can discuss further. All right, 3 things that you can do now to help. So like we were talking about earlier is know your dizziness checklist. It's important to kind of, if you're going to talk to any healthcare provider, is really take time to fill this out so you can properly kind of tell them, this is when I get to, have my symptoms. These are my symptoms without using the word dizziness. And this is how long it happens. You'll be getting today or tomorrow morning, you'll be getting what we call a guide to dizziness e-booklet. And this e-booklet, it has a lot of stuff that we explained today or we talked about, and it will have that checklist inside there. It'll also have resources and how to take action there too. And next thing, find support and resources. Vestibular.org is called Veda, is the company, but vestibular.org has tons of helpful resources. It also has support groups. It's endless. And so going on there, and you can get really kind of scientific, supportive articles and information is great. So that's a really good resource. Rani Wellness, like there you go too. It's a local, very good place to go to as well. And then you're gonna hopefully you're gonna take action, right? Book an appointment with Rani or I. And there's 2 ways you can actually get started with that right now if you want. You can type in scan. We do free 15-minute phone calls. And you can see if you're a rehab candidate. We'll answer any questions that you had today. So if you want that, you could type scan in the chat. You can also type assessment. If you don't need a scan, you already know that you want to have an assessment. You can also type that. You don't have to type in the chat if you don't want to. We could give you a call as well when we follow up. So those are questions. And then Ronnie, you have your how to get in contact with you, right?
Yes. So it was on the first slide. And Jennifer put it in the chat as well, yes, how to contact me. But yeah, I'm offering this program. It's a great program because you learn about 7 different meditation techniques that you can do anywhere, anytime. And it's part of building a daily practice and really helps with coping with stress, anxiety, and pain, which many of us experience often. So I highly recommend the program, whether you do with me or someone else, but I'd like to promote my program. And you can contact me directly if you'd like through my website, or my email is wellness@raniglick.com, and or call me. My number's on my website. And love to chat and see how we can work together. Thank you so much. This is a group program, by the way.
That's great.
Thank you so much.
Okay, so now what we'll do is, if you guys want, let me see if Jess, she might not be available. I want to do spin the wheel. Hold on, Ronnie, I'm just gonna be right back. I'm gonna see if Jess is available, and we'll do the spin the wheel so someone will win a lucky foam roller and some therapy balls. I'll be right back.
Sounds great. So does anyone have any questions? I think you can unmute yourself if you'd like and ask some questions, or you can type them in the chat. I hope you've enjoyed this session, and here's Jennifer again.
All right, perfect. Jess is about to come on. And then I'll start sharing my screen so she can, there she is. Hi, Jess.
Okay, so.
Okay, I'm going to stop sharing, Jess, so you can.
Yeah, sounds good.
Feel free if anybody has any questions. You guys are really quiet tonight. If you have anything, we're happy. We're here at your disposal.
Okay, do you guys see my screen?
I do. It's starting. There it goes. Yeah.
Perfect. Let me see if I can make this bigger. Okay, 3, 2, 1.
Dun, dun, dun.
Okay.
Marjorie. Amazing. Very good. Marjorie, if you live away, like out of Toronto or the province, we'll be happy to provide you with anything else if we need to. But if you live in Toronto, we'd be happy to have a session with you and give you your free foam roller and therapy balls. Perfect. All right, I have a question from Heather that says, can you have multiple reasons for dizziness? Absolutely. I have multiple people that come in and have a little bit of what I was talking about earlier, where their vision, they're like, I've been to the optometrist, my vision is fine, but then we do a few of the testing and we actually see that they have a little bit of a misalignment or their eyes aren't working well together, but they also have a previous vestibular disorder that hasn't all the way healed, or their proprioceptive system is really, really off. Or because of that visual misalignment, they've started not relying on their vision so much and over relying on another system. So yes, definitely. And we see it very, very often. So that's why it's important to really wean out all of the systems and test them in multiple different ways. So you're really confident when you're saying is not this, is this, and vice versa. Good question.
I have a question with arthritis in the neck. Can that really also offset, like set off, I guess, similar symptoms?
100%. We see people that come in, especially if there's arthritis in the neck and they've kind of have it on one side and not the other so much, or they're kind of turned this way and they've been like this for years. They kind of start sensing that this is, center. And it's not really, but then your other two systems are conflicting with that. And that mismatch between the vestibular system and the vision with the proprioceptive system leaves you with just like this low-lying kind of dizziness throughout the day that you can't really pinpoint. Those are pretty vague, like those people have a little bit of that vague symptom where they're like, it's just kind of dizzy. I don't know how to, kind of put my finger on it. But usually some of these tests, they actually will say, that's exactly how I feel.
Yeah, thanks. It's really helpful to know. So it's good to really get do the visual test to help, and also the alignment of the neck.
Alignment of the neck, look at the vision. I couldn't even count how many times someone's even recently been to the optometrist and they're still having these issues, but then I look and I can see like where their eyes aren't coordinating together, and it's just that they needed that referral to a neuro-optometrist to see that, and then voila, like much better.
Thank you.
Some of these individuals have actually trouble driving. They don't necessarily have that much trouble reading or stuff like that, but when they're driving, and because you're constantly looking at a red light, looking down at drivers, moving past, stuff like that, that's a common symptom that you'll have in those individuals.
Thank you.
All right, I'll leave you guys for a few more minutes to see if we have any more questions, and then we'll let you go. All right. Any more questions? All right. Well, thank you guys so much for joining our webinar. I thank you too, Ronnie, for giving us all your helpful information. I was just telling her before that I love her blog. Like, there's so much unreal, really great information there. So check it out if you have the time. It's wonderful. But thank you to everyone else. It was fun. And I hope everyone has a good night.
Bye.
Bye. Perfect. All right.
Well, thanks so much, Jennifer. That was great. You did a great job. So actually, I took some screenshots of your slides and stuff. Really helpful.
Oh, good. Yeah.
Will you send out the recording to people who attended?
I will ask Michelle and see, but I think that especially if someone had like couldn't make it or something like that, sometimes we'll send it out just in case that they need it.
I know a few people in my community who would be interested in it, so I was wondering if I could use it to send it to them because they might find it helpful.
Yeah. So
and it would promote your PhysioPlus as well.
Sure. Yeah. So reach out to that email that we've been on with Angelia, and we'll get it sent over to you.
Thank you. And thanks again. Anything else that comes up at PhysioPlus, I'd love to be involved. I really appreciate it. She has a nutritionist, doesn't she? She was selling products at one point too.
She was, and she was doing that for a while. So I'm not sure if she's still doing or not, but reach out and we'll see.
I'll reach out. Well, I really appreciate your support and thank you for including me. It's really fun, and I'll have to come and visit because I love Michelle. It's always so hard to get an appointment with her.
Oh my gosh, it's insane. It's absolutely crazy.
I've seen so many different osteopaths there over the years as well. So they're probably all gone. Thanks so much. Have a great night. Bye, Jessica. And I really appreciate it.
Have a good one. Bye.
Take care. Bye-bye.
Bye, everyone.